We're invited along to a media briefing to find out more about the action plan at the hospital for patients and their safety. It follows on a briefing that's been given to the members first. And, well, this is your baby as such. I mean, what reassurance are you going to be able to give the public at the minute, especially under the current situation of, how do you put it, some mistrust maybe that's going on up at the hospital particularly?
Yeah, I mean, we're aware that there's a lot of concern at the moment about patient safety at the hospital. There's been a lot of public debate. Unfortunately, there's been a lot of misinformation going around as well. So one of the purposes of today's briefing was to, first of all, explain what we do at the hospital to ensure that we do provide safe and effective care, and also to give Timwell members an update on where we are with making progress with our patient safety agenda.
So no new policies, just more communication then?
Yes, communication is very important, and
do you admit that it hasn't been there in the past, in the level that people probably have expected?
Yeah, I think that's perfectly true, and I think that's true of most NHS organisations in the UK. Robert Francis, in his recent report, has highlighted 5 areas which he thinks needs addressing, and 2 of them are to do with communication and openness, transparency, candour, and better communication are some of the themes that he's come up with. So all hospitals, all NHS hospitals in England, Wales, Scotland, Ireland, and on the Isle of Man are looking at the Francis report and trying to address the areas that they can identify apply to them. And we're doing the same thing.
By the very nature, when people are vulnerable, they're putting their trust in you as a health organisation.
Yes.
And there's levels now of concern that things aren't as good as they possibly could be. What would you like to say to that?
It's true that when people are vulnerable, then that's when they're most likely to come to harm. I mean, again, we know that no matter how perfect your organisation is, a certain number of patients will come to harm when they come into hospital. Some of that harm is avoidable, and we are concentrating on reducing the risk of avoidable harm. And we've been doing that for many years. This isn't something new that we've suddenly started to do. We've had systems in place since 2002 to ensure that patients get the most safe and effective care that we can provide.
Avoidable harm, the word avoidable surely means it shouldn't happen in the first place ever.
Absolutely. And
but it is happening.
It happens everywhere. And I mean, I don't want to quote statistics particularly, but we know that up to 10% of patients who come into contact with a health organisation in countries like North America or Europe, England, can come to harm from that contact. And some of them are avoidable. We know that in England, for instance, there are events called never events, which, as the name implies, should never ever happen. But there are over 700 of them do happen every year in the English NHS. We have the same checks in the Isle of Man, and I can tell you that only 1 has happened in the last 5 years. So, unfortunately, harm does occur to patients when they come into hospital, mostly because they are ill and vulnerable and therefore susceptible to harm. But we strive all the time to reduce the risk of that harm, but it would be dishonest of me to say that we will ever get it to 0, because I don't think we will.
Well, we'll continue with more on this in our next section.